Alto-sensorium, 120. Diagnosis, hypertension, emergency. IV labetalol. Okay, if not pregnancy, then sir, IV nicardipine has which option will be the better choice? Nicardipine. Okay, this one also I will define. Hypertensive emergency in pregnancy. Pregnancy, what is the drug you will give? And patient a normal, for example, a male, what will be the treatment? Okay, I will define this as well. Sure. Okay. Now let's have a quick recap. So I was talking about which syndrome, guys? Sheehan syndrome. Okay, so what is Sheehan syndrome? It's also called as postpartum pituitary necrosis or postpartum pituitary infarction. Why exactly is postpartum necrosis happening? Because when there is a significant blood loss, what is happening? There is an hypoxia, and when the hypoxia is prolonged, extension of the hypoxia will lead to the ischemia, and when it's a prolonged ischemia, it will lead to the necrosis. Okay, is it reversible? No. Necrosis is irreversible. Are you getting my point? Yes. After that, all the hormones that are coming from the pituitary, whether it will be LH and FSH, whether it be a prolactin, whether it be an antidiuretic hormone, whether it will be a thyroid hormone. Now, when the hormones are depressed, when the hormones are deficient, what will happen? When all these hormones are deficient, all the clinical features will be associated with the hormones that are deficient. If LH and FSH is deficient, what will happen? Amenorrhea. Sir, how LH and FSH nahi aa raha hai, estrogen and progesterone will not come. Eventually, there will be no proliferation of the endometrium and excretory of the endometrium. Patient will have amenorrhea. Now, what is the hormone that is responsible for the lactogenesis? Prolactin. When the prolactin is not coming, mother will complain of not able to feed the baby. Lactation failure hoga. Now, thyroid hormones are suppressed. What will be happening? Thyroid related disorders, antidiuretic hormone nahi hai. So what will happen? Diabetes insipidus. Okay, what will be the treatment? You substitute the deficient hormones. You substitute the deficient hormones. Is that clear? On MRI, there will be a classical sign called as pituitary ring sign. What is pituitary ring sign? There will be an enlarged pituitary bulge over the optic chiasm. Itna yaad rakho, big pituitary will be seen in a case of Sheehan syndrome. Now, a Sheehan syndrome patient, what is the main defect? Deficient hormones. The LH and FSH is not sufficient. Okay. Now, Asherman syndrome. In Asherman syndrome, I yesterday told you that the hormone levels will be what? Normal. There is nothing wrong with the hormones. Sir, why this is occurring? Because of the additions post curettage. If a patient is going for abortion, DNC ho raha hai, are you getting my point? Irrespective of, rather than having threatened abortion, we have bed rest and progesterone. All other types of abortion, we mostly go with dilatation and curettage. Post curettage, what is happening? Synic and additions are present, and that condition, patient presenting with the amenorrhea followed by abortion or dilatation and curettage, is called as which syndrome? Asherman syndrome. It's also called as uterine synechiae. Okay, and what will be the treatment? Additionolysis. If you will give FSH and LH, will it work? No, because hormones are normal. Okay, so the treatment will be what? Additionolysis. Treatment will be additionolysis. Is that clear? Now, do you understand the difference between? Always remember, whenever the case of Asherman syndrome will come, it will be mentioned that patient had an abortion or patient went for the curettage. Now, curettage kahan pe karte mainly? The molar pregnancy. Yes or no? After that, we discuss in an ectopic pregnancy as well, can be needed. Okay. Secondary bits of placenta. Secondary postpartum hemorrhage. Yes or no? Patient coming with the retained placental bits. Again, that can be a case of what? Curettage. And also, patient can have what? Secondary amenorrhea. Then third thing I discussed yesterday. Now you have three cases. You have a patient of PCOD, you have a patient of Asherman, and you have a patient of Sheehan syndrome. All of them have what? Secondary amenorrhea. What is a secondary amenorrhea? When a patient is not able to bleed for how many cycles? 3 cycles. Now patient is coming to you. Patient number 1. Patient have an Asherman syndrome. Okay, but do you know if she has an Asherman syndrome? No. She's coming. What is the first thing you do? UPT karta hai, right? Forget about that. I'm directly telling you the diagnosis. Okay. Now, first thing, when patient is approaching to you, patient is saying patient is having amenorrhea. You're giving estrogen. Patient is not bleeding. You are giving progesterone now. Patient is bleeding. What is your diagnosis? PCOD. Because what is deficient in PCOD? Progesterone. There is LH increase, but there is no LH surge. That's why you give progesterone. Patient bleeded. Your diagnosis is PCOD. Second patient is coming to you. Patient is having amenorrhea, you are giving estrogen, patient is not bleeding. You are giving estrogen plus progesterone, patient is bleeding. Hormones are deficient. What's your diagnosis? Sheehan syndrome. Third patient, patient is coming to you, patient is having amenorrhea, estrogen, no bleeding. Progesterone, no bleeding. What is your answer? Asherman syndrome. Is that clear? इसकी आवाज डबल आ रही है okay, chalo. Now let's play a rapid fire. Okay, whatever we studied yesterday for 4 or 5 minutes, and then we start with a PSM. Is that clear? Chalo, fast. हाँ हाँ, ये तो क्या कनेक्ट? हाँ, इसको कर दिया मैंने, अब नहीं आ रही है. चलो. I will also check this question. कोई बात नहीं है. Okay, thanks. Chalo. Now let's have a fast revision of whatever we studied yesterday. Okay, fast. Okay, tell me most common cause of a secondary postpartum hemorrhage. Fast. Retained placental pets. What's the most common cause of ectopic pregnancy? PID. You have a patient coming to you with the complaints of a pain abdomen and the vaginal bleeding. Okay. On examination, the blood pressure is 90/60. There are features of syncope and shock. What is your management? It's a diagnosis of ruptured ectopic pregnancy, and the management will be only one thing: salpingectomy. Salpingectomy. If the beta HCG is less than 5,000 and the ectopic size is less than 4 centimeters, what will be your management? What will be your management? Medical. What are the drugs in the medical management we use? Methotrexate. Yes. Bata do. Mifepristone. Then actinomycin and KCl. And KCl. Is that clear? Yes. Followed by that, if you have a patient coming to you, pain abdomen, okay, on PV examination, os is open, and products are bulging or hanging, what will be your diagnosis? Inevitable abortion. Inevitable. If a patient is complaining the same scenario, but patient is giving a history of passage of some masses, what is that? That will be incomplete abortion. Yes, because os is open, products are not bulging. Patient is giving a history of passage that I pass some of the clots. That is going to be your incomplete abortion. If there is a foul smelling discharge, okay, or a patient is having sepsis, that is a septic abortion. Os is closed, period of gestation is corresponding to the uterine size. That's going to be your threatened abortion. Os is closed, patient is giving a history of passage. Is that clear? No warning signs and symptoms, or there's a crumpled sac. Missed abortion. Is that clear? Now, followed by that, we studied about the causes of an anatomical abortion. Anatomical causes. Your first one is going to be septate uterus. What is the management? Hysteroscopic resection. Bicornate uterus. What's the management? Stressman metroplasty. And incompetent cervix. When the cervix is less than how many centimeters? 2.5 centimeters. What will be the management? Cerclage. What is the name of the cerclage that we use? McDonald cerclage. Followed by Schrodkar cerclage. And the last one, if they both are failed, abdominal cerclage. Is that clear? Now tell me, what are the antibodies seen in APLA, antiphospholipid antibody syndrome? Anticardiolipin, anti-beta-2 glycoprotein, and third one is going to be lupus anticoagulant. Lupus anticoagulant. Is that clear? Now what will be the treatment? Again, a repeated question. Low molecular weight heparin plus aspirin. Is that clear? But if there is an inherited thrombophilia, what will be the gene mutation? Tell me, prothrombin gene mutation, factor 5 Leiden mutation, and protein C and protein S deficiency. Is that clear? Is that clear? Okay. What other things we studied, the important ones? What is the cause of the bleeding in a PCOS? Ischemic withdrawal. Okay. Now, classical signs. T sign is seen in T sign. Monochorionic, diamniotic. Twin peak sign is seen in dichorionic, diamniotic. Pearl of string appearance is seen in PC. Follicles in the center. OHSS. Snowstorm appearance. Molar pregnancy. Hydateiform mole. Okay, any other radiological sign we studied? Cannonball metastasis. When the cancer is going from choriocarcinoma to the lungs. Which stage? Third stage. And it's a condition where we'll give the multiple doses of a methotrexate. Is that clear? Methotrexate. Antidote is folinic acid. What's the antidote? Folinic acid. You have a patient coming to you, placenta previa at 35 weeks. Vitals are stable. What will be your management? What is the name of regime? McAfee Johnson's regime. What is the McAfee-Johnson regime? You admit the patient, you arrange the blood, you give the steroids. What are the two steroids we give? Betamethasone and dexamethasone. Betamethasone, how many doses? Dexamethasone, how many doses? B2, D4. 12 into 12, that's 6, 6, 6, and 6. 12 hourly, and the other one is 24 hourly. Is that clear? What is the first confirmatory test? The best test for fetal lung maturity? Yes? Phosphatidyl glycerol. What is the best test? Phosphatidyl glycerol. We also go for lecithin sphingomyelin ratio more than 2:1, shake test, 9 blue paper test, and phosphatidyl choline. Is that clear? Any other important stuff we studied? What is the pathophysiology of PIH? Incomplete trophoblastic invasion. Eclampsia, drug of choice is going to be magnesium. What should be the level of a magnesium? 4 to 7 milli equivalent. Okay, what is the first sign of toxicity? Knee jerks are absent. Okay, what is an antidote? Calcium gluconate. Is that clear? GDM. What are the two hormones that are responsible for the resistance of an insulin? HPL and estrogen. HPL and estrogen. After giving 75 grams of sugar, you're calculating the sugar at two levels. After 1 hour and after 2 hours. After 1 hour, the level should be less than 180. And after 2 hours, level should be 1. Very good. What will be the oral hypoglycemic drugs we use? Metformin and glyburide. Metformin belongs to the class of? Metformin belongs to the class of? Yes? Biguanides. Having a side effect of lactic acidosis. आवाज repeat आ रही है, मैं थोड़ा disturb हो रहा हूँ इससे. पूरा कम नहीं होता इसमें? Yes. Okay. अगर होता है तो मैं बता देता हूँ. Is that clear? Yes. Now GDM में, what is the most common cardiac defect? TGA. And neural tube defect? Sacral agenesis. Is that clear? What is the marker of a neural tube defect? You will check in an amniotic fluid. Acetyl cholinesterase. Okay. Yes. Okay. I think it's enough for revising OB-GYN. Let's have a PSM first. Okay. वरना PSM यहीं रह जाएगा. Okay, all those students who missed yesterday's session, no problem. There is a recorded in the app. You guys can record from the app, number one thing. Number second, if you have any doubts, okay, you can ask me. Okay, all the students who have doubts related to the gynae, ping me up in the Telegram. I will answer. Let's complete PSM first, okay? No problem. Is that clear? And meanwhile, if we're able to finish PSM before the time, then we'll revise both PSM and OB-GYN, have a rapid fire like this, okay? So that you will able to remember at least the most important things. Is that clear, online people? Are you all there? Yes. Okay, try to be interactive like yesterday. Keep revising, keep answering. Okay, because this is the time to remember. Chalo. Now the first question from the PSM chapter pneumoconiosis. Okay. A 47-year-old man presents with a progressive shortness of the breath and a history of working in a quarry for 20 years. His chest X-ray shows the multiple small nodular opacities predominantly in the upper lobe. So it's affecting, it's a type of a pneumoconiosis affecting which lobes, Bacho? Upper lobes. And the hilar lymph nodes have eggshell calcification. What's your most likely diagnosis? What is the most likely diagnosis? Silicosis. So eggshell calcification is seen in silicosis. Eggshell calcification is seen in silicosis. Okay. Now let's discuss about a pneumoconiosis. Okay. What is a pneumoconiosis? It's a respiratory disease that occurs due to the exposure to a dust. It's a respiratory disease. It's a respiratory disease occur due to exposure to dust. It's a respiratory disease that occur due to exposure to the dust. And if I talk about the size of the particles that are most dangerous, that's going to be 0.5 to 3 microns. Okay, they are most dangerous particles. Okay. Now, sir, if I talk about the first pneumoconiosis, that's going to be the silicosis. causes. Okay, and this silicosis is going to be the most common pneumoconiosis. The first part is it's going to be a most common type of pneumoconiosis. It's going to be a most common type of pneumoconiosis. Okay, second one, a patient is exposed to which type of dust? Silica dust. Okay, there is an exposure to silica dust, or we can say stone dust, or which miners? Bauxite. Okay, because bauxite is a type of stone only. Yes or no? Yes. So exposure to the stone dust or silica dust, a patient will have what? Silicosis. And this patient of silicosis have a continuous follow-up for which condition? Tuberculosis. Okay, he's more prone to which condition, guys? Tuberculosis. Okay. Now, if I talk about the chest X-ray finding of a patient having what? Silicosis. We have a classical calcification on a hilar notes. What is the what is the calcification called as? Eggshell calcification. What's the calcification? Eggshell calcification on chest X-ray is going to be the diagnosis of silicosis. And now, if we integrate a bit, if a patient is coming to you with a calcification of chest X-ray, but the calcification is which calcification? Popcorn calcification on chest X-ray. My dear students, your answer is going to be pulmonary hematoma. Very good. Your answer is going to be pulmonary hematoma. One more MCQ that they can ask is most common benign tumor of the lungs is pulmonary hematoma. Most common benign tumor of lungs is going to be pulmonary hematoma. Now, this popcorn calcification on mammography, sir, our answer is going to be fibroadenoma. A 30-year female will come with a mobile mass. Okay, your answer is going to be fibroadenoma. Is that clear? So popcorn calcification on mammography is fibroadenoma. On chest X-ray is pulmonary hematoma. Eggshell calcification on chest X-ray is going to be silicosis. Then popcorn cell read stomach, you already know. ठीक है ना? चलो. Popcorn cell is seen in which condition? Yes, popcorn cell. Hodgkin's lymphoma. Hodgkin's lymphoma. Is that clear? Is that clear? Now, if I talk about one more appearance of a chest X-ray of a patient having silicosis, what is the name of a condition? It's a snowstorm appearance. Very good. It's a snowstorm appearance. And snowstorm appearance, yesterday we also studied on the USG, is going to be molar pregnancy, hydatiform mole. Is that clear? So snowstorm appearance on the chest X-ray is which pneumoconiosis? Silicosis. Is that clear to everyone? Is that clear to everyone? Yes. Popcorn calcification radio में on chest X-ray कहाँ पे? Pulmonary hematoma. And on mammography, fibroadenoma. 30-year mobile mass, Mickey Mouse and fibroadenoma. Very repeated question from the breast. Okay. Chalo. Next. And they will ask the patient want to have a continuous follow-up for which condition? That your answer is going to be tuberculosis. Your answer is going to be tuberculosis. Now the second one is called as asbestosis. It's due to the exposure to which dust? Asbestos dust. Which industries? Yes, very good. Which industries? Shipyard or shipbuilding. That's going to be shipbuilding industry. That's going to be shipbuilding industry. Okay. If I talk about asbestosis, the main important thing about asbestosis is it's the only pneumoconiosis that is associated with the malignancy. If I talk about the most common malignancy, your answer is going to be adenocarcinoma of the lung. But if I talk about most specific, your answer is going to be mesothelioma. So write it down. It's a only pneumoconiosis. It is the only pneumoconiosis associated with malignancy. Associated with malignancy. If I talk about most common malignancy, your answer is going to be yes, adenocarcinoma of lung. If I talk about most specific, your answer is going to be plural mesothelioma or mesothelioma. 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 Can you tell me what's the marker of mesothelioma? बता दिया उन्होंने पहले ही. My God. Calretinin. They already know that I'll ask this question. Calretinin. Okay. What is the marker? Calretinin. Okay. They are playing smart. Now teacher has to play smart. मैं पूछूंगा ही नहीं जो ये सोचेंगे. ठीक है ना? Okay. Now tell me. We have a classical bodies, sarkari bodies that are found in where? Mesothelioma. Samoma bodies. What are the bodies? Samoma bodies. Okay. Now these samoma bodies are made up of calcium on a concentric bodies, circles centered at a center. These bodies are called which bodies? Samoma bodies. Which ovarian tumor? Serous? Now tell me one thing. If you have to stain these samoma bodies, what is the stain you will use? Rhodamine for copper, ma'am. Yeah, बता दिया इन्होंने. Von Cosa stain. So staining calcium, it's the again neat PG question. Question was asked. Patient had a case of mesothelioma and these are the bodies what found. What will be the stain used for such bodies? Now these bodies are made up of. Now what is the stain for calcium? Von Cosa stain. There is a one more stain for the calcium. Alizarin, red. Alizarin. Now depending upon if there is a minimal calcium or there is a high calcium. Is that clear? Yes. Other stains you remember? Yes. AL. Chalo. Am I audible now? Yes. Yes, sir. Okay, so I was talking about mesothelioma. What is the type of the stain you will use for samoma bodies? Your answer is going to be Von Cosa stain. So already we revised from the patho all the stains. ठीक है ना? So remember all these stains. One question from these stains will come for sure. Okay. Now the other type of bodies. This is your NEET PG. Recall this type question. Okay. Remember always. See, whenever they will give a histopathological image in case of a pneumoconiosis, एक ही हो सकता है. What is the answer? Asbestosis. What is the answer? Asbestos. Whether you know or don't know, you have to use your mind. Okay, this is going to be the case of asbestosis. और कहीं पे pink slide मैंने लगा दी? नहीं, है ना? चलो. What is the bodies called as? Guitar-shaped bodies. Okay, we call them ferruginous bodies. Ferruginous or ferruginous bodies or asbestos bodies, and they are found in the asbestosis. They are found in the asbestosis. Is that clear to everyone? Yes. Now, only pneumoconiosis that is associated with the malignancy is asbestosis. The most common cancer is going to be adenocarcinoma. The most specific is going to be mesothelioma. Mesothelioma have a marker of calretinine, and mesothelioma have a samoma bodies which are concentric centered bodies having a calcium, and we stain the calcium with a Moncasa stain to try to integrate. If we study PSM directly way of PSM, trust me, it's boring. Okay, but अगर हम थोड़ा इसको mix करके ना, from a medicine point of view, from a patho point of view, radio point of view, it will become more and more interesting. The only chapters that we cannot integrate, biostatistics and epidemiology. वहाँ पे कुछ कर सकते हैं नहीं. But यहाँ जहाँ पे whenever it's a possible, let's integrate so that you can remember. Okay. Next is going to be anthracosis. What is the agent in anthracosis? Coal dust. Yes, that's going to be coal dust. And the patient of anthracosis is going to be have progressive massive fibrosis. Patient will have progressive massive fibrosis. Now, my dear students, if a patient of anthracosis have rheumatoid arthritis, we have a classical syndrome called as Kaplan syndrome. So, right, rheumatoid arthritis plus anthracosis. So, we have a syndrome called as Kaplan syndrome. Speed is okay or am I fast? Speed is okay, guys? Chalo. Kaplan syndrome. Now tell me, this Kaplan syndrome, it's also called as rheumatomycoconiosis. क्या बोलते हैं इसको? Rheumatomycoconiosis. Can you tell me what is the antibody seen in case of a patient having rheumatoid arthritis? Anti CCP. Very good. Anti CCP. Very good. Right. What is the antibody? Anti CCP. Clinical case will be given. छोटा सा लिखा होगा. This antibody was found. Clear cut diagnosis. Anti CCP goes with the rheumatoid arthritis. Okay. Now you have a patient. Okay. You have a patient. Along with that, patient is having uh, splenomegaly and the neutropenia. What is Felty syndrome? What is the name of syndrome? Felty syndrome. Okay. Now this anthracosis, my dear students, this in case of an pigmentation, intracellular pigmentation, we have a black lung. You might have studied in the pathology. What is the lung called as? Black lung. And remember this anthracotic pigment. What are the different types of pigment you have studied in patho? You might have studied lipofuscin. Are you getting my point? Yes. Golden and brown spots. Padha hai na? Also called as wear and tear pigment. Hai na? All these things you have studied. But there is a one pigment that is an exogenous most common. All other pigments are what? Endogenous. But one most common exogenous pigment. What is your answer going to be? Anthracotic pigment. Your answer is going to be anthracotic pigment. Also called as which lung? Black lung. Also, why is black is forming? Because of the carbon particles. Because of the carbon particles. Okay, so I will write in the bracket black lung so that you have a hint. Okay, anthracotic pigment. And which condition, bacho? It's the most common, sir, exogenous. It's the most common exogenous pigment. It's the most common exogenous pigment. The next one is going to be bagasosis. What is the dust in bagasosis? Sugarcane dust. Okay, very good. So dust is going to be sugarcane dust. Now, if they will mention some industry, कौन सी mention करेंगे? Cardboard industry. Okay, they will mention the cardboard industry. What is the bagasosis? What is the fungus that is associated? What is the fungus associated? Thermoactinomycetes sacchari. Very good. Thermoactino. Very good. Okay. And if I talk about the prevention of bagasosis, for the prevention, what do we use? 2% propionic acid. So we use 2% propionic acid. So that is going to be bagasosis. So how many we studied so far? 4 conditions. So the first one, if a patient is having an exposure to silica dust, what's your answer? Silicosis. If a patient is having asbestos dust, sugarcane dust, coal dust, eggshell calcification, samoma bodies, Samoma bodies. Samoma bodies. 2% propionic acid. 2% propionic acid. Black lung. Black lung. Rheumatoid arthritis. Rheumatoid arthritis. Is that clear? Yes. So these are all the MCQs. Whatever all the points I'm recalling, they are all the MCQs. Most common type is going to be silicosis. Most common type is going to be only pneumoconiosis associated with malignancy. Chalo. So next one, that is going to be your bicynosis. And in bicynosis, what you will remember? Exposure to cotton dust. And what else? What else you remember from the bicynosis? Yes, chest tightness. Which chest tightness? Monday chest tightness. है ना? पढ़ाई होगा. Farmer's lung, also called as moldy hay. There in dust is grain husk. Very good. And the agent is going to be mycopolyspory tani. Okay. Now sidrosis. Very good. Exposure to iron. Chalo. Bird fancier lung. Exposure to bird droppings. And berylliosis. Airspace industries. Very good. So that's all about what? Pneumoconiosis. Is that clear to everyone? Yes, clear to everyone? Yes. So revise with me fast. I will tell the dust, you will tell me a type of pneumoconiosis, or I will tell the one particular finding of each pneumoconiosis. Is that okay? Airspace industries. Berylliosis. All the people online just write BR. पूरा नहीं लिखना है, fast. Airspace industries. Airspace industries. Cotton dust. Cotton dust. Cotton dust. Cement. 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 बताओ सारे आंसर बता रहे हैं डिफरेंट कोई तो एंथ्राकोसिस बता रहा है सीमेंट ग्लास इंडस्ट्री ग्लास इंडस्ट्री ग्लास इंडस्ट्री कोल डस्ट कोल डस्ट कोल डस्ट snowstorm appearance mesothelioma most common sugarcane dust Monday chest tightness that's clear. Oh, is that clear? Farmer's lung kahan se ho gaya? Bicynosis. Farmer's lung is different. Moldy? Hey, is that clear to everyone? Now tell me, a 70-year-old retired construction worker presents with a dyspnea and weight loss. He has a history of asbestos exposure. A chest X-ray shows pleural thickening and a mass in the lower lung zone. What is the most concerning diagnosis? Mesothelioma. My dear students, most of the times, whenever a clinical case mentions weight loss, what are you suspecting? Malignancy. पहली बात. दूसरी बात, what is the another hint? Pleural mesothelioma to ho raha hai, and what is there? Mass in the. So what is your answer? It's going to be what? Mesothelioma. Asbestos, you already know. Bronchogenic carcinoma, you already know. Is that clear? Chalo. As per the national immunization schedule, which vaccines are indicated at the first visit of immunization of a 13-month-old baby who has not been previously immunized? Now a patient is coming to you and patient is not immunized. What is the age of a patient? 13 months old baby. So this is a question from what? Delayed vaccination schedule. Okay. Before in vaccination, they used to ask what? पहले पूछते थे direct. Then they ask strains. Then they ask vials, open vial policy. But these days, what is the favorite question? They ask what? Delayed vaccination schedule. Okay. So let's revise all about the vaccines. Is that clear? Now, what are the vaccines you will give at the birth? Bob. क्या देंगे? Bob. What is Bob? BCG, OPV, hepatitis B. Okay. Then at 6 weeks, what are the vaccines you will give? DPT 1, then OPV 1, then hepatitis B 1, then HIB 1, then 1. Is that clear? Now in Kahi at 10 and 14 weeks, DPT 2, OPV 2, Hep B 2, HIB 2, and Rota vaccine 2. Okay. Then at 14 weeks, so DPT 3, OPV 3, Hep B 3, HIB 3, and Rota 3. Is that clear? At 9 months, we usually give what? MR, Japanese encephalitis 1. We give pneumococcal vaccine booster dose. कौन सा देते हैं? Pneumococcal vaccine का booster dose. And we also give which vitamin? Vitamin A. Yesterday I discussed what is the teratogenic effect of vitamin A? Cleft lip and cleft palate. Now integrate. Cleft lip and cleft palate is the most common cause for? Very good. Polyhydramnios. Good guy. Polyhydramnios. क्या लिख रहा है verdict? 16 to 24 months. Okay. Then you give OPV booster 1. Okay. Then DPT booster. Then Japanese encephalitis 2. And then one more, we have MR2. Next one, at 5 years, what do we give? DPT booster, second. 10 to 16, tetanus. Now tell me, yesterday I told you about that tetanus. If a patient is a primary gravida, how many doses? If a patient is having multi-gravida, last childbirth less than 3, more than 3, minimum gap between 2 vaccines. 4 weeks. 4 weeks. First dose you always give as soon as possible. And second dose you give 3 weeks prior to the estimated date of delivery. Is that clear? Is that clear? Next. So, delayed vaccination schedule. Now a patient is coming to you, okay? And patient has missed all the vaccinations so far, okay? Now, depending upon which type of vaccine can be given up to which age limit, okay? If I talk about BCG, it can be given up to 1 year. Write it down. It can be given up to 1 year. It can be given up to 1 year. If I talk about Rota vaccine, again, up to 1 year. If I talk about IPV, up to 1 year. Now, depending pentavalent vaccine, depending upon first dose, second dose, and third dose. If I talk about pentavalent first dose, it can be given up to 1 year. So if I talk about pentavalent second and third dose, up to 7 years. If I talk about PCV, up to 1 year. If I talk about OPV, 5 years, up to 5 years. MR or MMR, that can be also given up to how many years? 5 years. If I talk about DPT, if I talk about DPT, yes? If I talk about DPT, how many years? If I talk about Japanese encephalitis, up to 15 years. Up to 15 years. Now come back to the question. Now come back to the question. Now what is the age of the baby? 13 months. 13 months is more than 1 year, है ना? तो already up to 1 year वाले vaccine BCG को काट दो. Now the answer is between B and D. Now which vaccine among the following can be given only up to 1 year? Pentavalent which dose? First dose. So this also goes. Your answer is going to be D. Very easy to rule out. What will be the answer? D. OPV first dose, DPT first dose, and measles first dose. Is that clear? Is that clear? Yes? Chalo. Now, sir, the strains of vaccines. The strains of vaccines. Sir ने तो रटवा लिया होगा. What is the vaccine strain for BCG? Danish 1331. Second one, yellow fever 17D. One question was asked in the yellow fever that the vaccination certificate of yellow fever is valid, but from 10 days after the vaccination until the lifelong. That is your PYQ. Okay. Then in Japanese encephalitis, we have live and killed. Live is going to be SA 14 14 2, and Japanese encephalitis killed is Nakayama. Then Rota, name of that's a name. We call them a strain. Rota vaccine. What is the name? Strain R1XX414. If I talk about influenza, A72009, California. Measles, Edmonton, Zagreb. Okay, then rubella, RA2273. बता दो जेरेलिन. Mumps. Mumps we have Jerilyn. Then बता दो chicken pox or varicella zoster. That's going to be which strain? Oka strain. IPV, Salk. OPV, Sabin. Is that clear? Is that clear to everyone? Yes. So what are the vaccine strains? So BCG is Danish 1331. Yellow fever is 17D. Japanese encephalitis live SA 14 14 2. Killed is Naka Yama. Rota vaccine is going to be R1XX414. Influenza is going to be A72009 Caliph. Edmonds Zagreb is measles RA273, rubella, Jerilyn, mumps, Oka, chickenpox, IPV, Salk, OPV, Sabin. Okay, IPV, Salk, OPV, Sabin. Always IPV, OPV में confusion होता है. So IPV में I, Sabin, they are not matching. Remember that. Okay, Sabin में I आता ना तो वो OPV के साथ है. Salk में I नहीं आता. Remember that way. Okay. Now I will ask fast strain. You will tell me the vaccine. ठीक है ना? रट लो. The only way to remember PSM is gotification. Now, Edmonds Zagreb is a strain for measles. अब मैं इसमें क्या concept बनाऊं? Is there any concept? No. The only way to remember PSM is what? रट्टा. अब कुछ भी बना के measles में कुछ भी तुम hints मार दो. The only way is to gotification. Yes, there are some places where you have to understand the things. Okay, but the only way to remember PSM is, I think most of the non-clinical subjects आपको याद करना ही है ना? If there is a von Casa strain for calcium, ये तो clear cut है. अब मैं यहाँ पे पेशेंट आ नहीं रहा है, उसको ब्लीडिंग हो रही है, पीरियड ऑफ जेस्टेशन 35 वीक्स है, आप लोग फीटल डिस्ट्रेस देखोगे, उस हिसाब से आप दिमाग लगाओगे एंड आंसर कैन बी अकॉर्डिंग टू डिफरेंट आंसर्स डिपेंडिंग ऑन सिचुएशन. बट इन नॉन क्लिनिकल सब्जेक्ट्स और इन योर पेपर 1, It's 85% of condition do or die. वो पूछ रहा है, आपको बताना है. अब question आएगा, which of the following vaccine is given at the time of birth? Any concept you already know, either it's Hep B, OPV or BCG. Are you getting my point? So the more we will try to what? Memorize the things about the PSM, the better is the answer. The better is the preparation. Chalo, bata do fast. Edmond Zagreb, which vaccine? Measles. Gerelin is mumps. Gerelin is RA273. RA273. Nakayama. Nakayama. SA1414-2. SA1414-2. Danish 1331. Danish 1331. A72009 Caliph. A72009. SAL के Salk. EPV. Sabin. Oka. 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 Very good. Which vaccine can be given up to 15 years? Which vaccine can be given up to 5 years? Which vaccine can be given up to 5 years? Which vaccine can be given up to 1 year? BCG, RVV, pentavalent, first dose. Pentavalent, second and third dose can be given up to 7. Is that clear? Is that clear? Chalo. Now, more important. Sir, what is that? Adverse effects. Now, more important is going to be adverse. Now, vaccination is important. The reason is, कुछ भी पूछ सकते हैं vaccination से. Question आना ही आना है. Now, the ideal observation time after the immunization is how many minutes? 30 minutes. Now, there are some vaccines causing following conditions. If I talk about the paralysis, OPV, hypersensitivity reaction and the shock, hepatitis B, toxic shock syndrome, measles vaccine. Chalo, my question to you guys. Which contraception causes toxic shock syndrome? वो तो substance होता है उसमें. Douche cap, vaginal diaphragm. Douche cap, vaginal diaphragm. What is the way to use? 6 hours prior to intercourse, 6 hours after the intercourse. And if it's remaining inside, it can cause toxic shock syndrome. Toxic shock syndrome is caused by staph aureus. Staph aureus. Remember that. Okay. GBS. Killed. What's the causative agent of GBS? Causative agent of GBS. ये बता दिया. Campylobacter. Campylobacter. Intersusception. ये तो सरकारी है. रोटा वैक्सीन. ठीक है ना? Now, intersusception. Clinical case be given that on examination there was a sausage-shaped lump. What is the other finding of intersusception? Red color jelly stools. What is the radiological sign? Target sign and clause sign. Very good. Excellent. ठीक है ना? Febrile seizures. Very good. Measles. Persistent crying. P for persistent, P for pertussis. Thrombocytopenia. MMR and Hep B. Neurological complications. Yes? Neurological complications. Neurological complications. Yes. D, P, T. Is that clear? Is that clear? GBS, intersusception, toxic shock syndrome. ये तीन याद रखो. ठीक है ना? Main. Because GBS, they can, intersusception, they can give a clinical picture that baby was found to have a sausage-shaped lump and all this stuff. What will be your what? Vaccine that can be caused the side effect. Your answer is going to be rota vaccine. Most common cause of diarrhea in children's. Rota virus. Most common cause of diarrhea in HIV patients. Cryptosporidium. Crypto. Most common cause of diarrhea in neonates, infants. necrotizing enterocolites. That is the cause of what? Diarrhea. ठीक है ना? Travelers, E. coli. Very good. Travelers is E. coli. और कुछ हम यहाँ पे कर सकते हैं. Hepatitis B. चलो hepatitis के बारे में. Fecal oral is A and E. Fecal oral is A and E. Most cancerous, which can cause the cancer of chronicity, C. Fulminant hepatitis in pregnancy, E. Is that clear? Anything else? बस इतना ही है hepatitis के बारे में. A and E is fecal oral. Okay. DNA B. Chronicity and cancer is C. Pregnancy is E. Is that clear? Chalo. Now open vial policy. What is the open vial policy? Yes, once you open the vaccine, you can be used up to 28 days. Now tell me the vaccines on which the open vial policy is applicable. It is applicable on all T series and OPV and what are the vaccines it is not applicable on? So right, it is applicable on DPT, TT, IPV, OPV and Hep B. It is not applicable on BCG, Japanese encephalitis, MMR. Is that clear? Yes. Is that clear? Chalo. Now Mission Indradhanush. What was the Mission Indradhanush? It was launched on 25th of December 2014. Okay. And as per this, you have to immunize 0 to 2 year kids and also what? Pregnant ladies. Now, my dear students, how many vaccines are there in Mission Indradhanush? 7. फिर कितनी आई? 4 and then 2. Is that clear? Now, old 7 first. BCG, diphtheria, pertussis, tetanus, OPV, hepatitis B, and measles. Is that clear? These were the first 7. Then 4 more were added. What are the 4 vaccines? Very good. Japanese encephalitis, IPV, Rota vaccine, and MR. Then 2 more. Pneumococcal vaccine and influenza B. Influenza, which virus? Influenza is caused by which virus? वो तो BCG आ गया ना शहजाद BCG. Okay. Influenza, which virus? बता दिया इन्होंने. Orthomyxovirus. Which virus? Orthomyxovirus. Kevin, answer. I'm not speaking in Hindi. Chalo, tell me. Which virus? Orthomyxovirus. What's the drug of choice for influenza? Oseltamivir. NEET PG simple question. What is the mechanism of action of oseltamivir? Neuroaminidase inhibitor. Neuroaminidase inhibitor. Oseltamivir is a drug of choice for influenza, either A or B, direct. You know, oseltamivir. My question to you: what are the other drugs for influenza, IV and inhalational? इसी में है oseltamivir, panamivir, zanamivir. These are the 2 drugs, inhalational and IV drugs. Is that clear? Inhalational and IV drugs. Is that clear? So oseltamivir mechanism of action? Neuroaminidase inhibitor. Neuroaminidase inhibitor. What is the virus causing? Orthomyxo. What is the name of the vaccine strain? A72009. Caliph. Is that clear? See, all the common things that is going to be tuberculosis, influenza, HIV, okay, malaria, you cannot skip. The most of the questions they will ask from which conditions? These conditions only. Are you getting my point? Which are common in India. वो यही पूछेंगे जो हॉस्पिटल्स में वट एवर इज गोइंग ऑन अराउंड सर्जरी में, जैसे appendicitis. Are you getting my point? You go with the pancreatitis, you go with the PUD, you go with the eclasia, GRD, main common things. Cholecystitis, okay, hemorrhoids, breast abscess. These are some topics वो पूछना ही पूछना है, because that's what's going on the hospitals day by day. You cannot skip those topics. Main things. You take an example of a CNS. If I will ask you, tell me the CNS tumor that they can ask. See, meningioma is the first thing will come in your mind. Meningioma पूछते ही पूछते हैं. Glioma rarely. Are you getting my point? Thyroid में papillary पूछता ही पूछता है. Now if you compare papillary with the aplastic, ज़्यादा पूछता क्या है वो? Papillary. Or which cancer? Medullary. These two are the hot topics. So every time, whatever you are studying, that is the mean. Why we are studying right now? You already studied these things, yes? But right now the rapid revision is to finish it up. कि भाई these topics are very important. Okay, at some point you might feel, अरे I'm studying these things from last 6 months. Again, Mission Indradhanush, topic will be same, trust me, but the way of asking questions will be twisted. He cannot give you cake. वो डायरेक्ट ये नहीं पूछेगा ना कि not applicable on, applicable on. He will not ask Gerilyn. Now all the vaccines that we studied, why? Because vaccination is very important. Why I'm focusing more on vaccination? The reason is all the schemes that are going on. The first thing is the easy way to eliminate or eradicate the diseases is what? Immunization. If you will only immunize from the birth only, what will happen eventually? After 10 years, 15 years, 20 years, we are able to control. अब neonatal tetanus देखो कैसे कम हुआ? When we try to vaccinate the pregnant ladies of with 2 doses and 1 dose, depending whether they are primary gravida and multi gravida. So all the schemes that are going in the country, you have to. PSM is all about that only. Main stuff. Okay, there are some things plus minus that will come in the opinion based. For example, during my time, मैंने बोला था एक question आ गया था that all people are coming, they went for the party, there is a dust after party, कचरा जमा हो गया, okay, all the dust was there. What you will do to that? What you will do to that? Now you don't know whether it was degradable or non-biodegradable. You don't know that whether it's the fruit dust or it's polythene. The options were you will burn, you will put that in the water, you will keep in the open air. Now you never know what type of a dust there was. So there are opinion based question as well. उससे पहले वो toilet flush वाला question आ गया था. Some PSM questions are something that's not in your notes. Not in your notes, not in any note. But हाँ, they will be in the notes. When? After your exams. 4.0, 5.0, 6.0, ऐसे ही तो आएगा ना? हाँ, चलो. So remember, if you feel like, okay, you know these things, no problem. You have to know. Question यहीं से आएगा. And trust me, when the question will be in front of you, you will be like, अरे ये तो पढ़ा है. And most of the times, what is happening these days? The information about the question that you have, that's already given in the question. Recently, I studied the question. It was about pheochromocytoma. Okay, I'm studying everything. I know these are all things I know about what pheochromocytoma. But then the question goes into the advanced. Now you might have studied वो men to A, men. वहां से integrate करके question पूछा. So your knowledge should be not limited. It should be diverse. That is why the only way to go ahead is integrate. अगर इन्फ्लुएंजा पढ़ा, इन्फ्लुएंजा को फार्माकोलॉजी के ड्रग के साथ इंटीग्रेट करो, वैक्सीन के साथ इंटीग्रेट करो, माइक्रो में वायरस के साथ इंटीग्रेट करो. एंड इन्फ्लुएंजा का अब अगर इंक्यूबेशन पीरियड की बात करेंगे 18 to 72 hours. So influenza is all cleared. So whenever you are studying something, try to integrate, because MBBS all 19 subjects are what? Connected. Now if one topic you are studying, now it's damn sure that this topic is connected to other subjects. You take any single thing. DPT ले लो, DPT का वैक्सीन शेड्यूल, डिप्थीरिया को माइक्रो के साथ ले लो, सीडो वाइटिश मेम्ब्रेन, है ना? व्हाट इज द मीडिया? लॉफलर्स मीडिया, है ना? देन एलिक्स टेस्ट, देन फार्मा के साथ ले लो, व्हाट इज द ड्रग ऑफ चॉइस? एरिथ्रोमाइसिन, मैक्रोलाइट्स, हो गया माइक्रो का डीपीटी. वैक्सीनेशन में यू ऑलरेडी स्टडीड. So these are the things you will try to what? Integrate. The more you will try to integrate, the better it is. The reason is at that time you have to remember all 19 subjects for how many minutes? 5 hours. And all the hard work that you are putting from last 6 months, it is only for how many hours? 5 hours. Now, sir, इतना 5 घंटे इतनी मेहनत कर रहे हो, all is the presence of mind. So if we are studying one topic, and from one topic we are going to where? Here, there. It should be what? Accuracy. Because वो तो आपको subject wise पूछेगा नहीं. First question will be pediatrics. Second question, you never know what it can be. It can be from any other 18 subjects. है ना? और bouncer होगा तो पता ही है. So I again tell you guys, whenever you will solve these questions, I also already told you yesterday, I'm telling one more time that when you will sit for the exams, my opinion is only attempt the questions that you know first. There are some questions, most common type of pneumoconiosis. पता ही है क्या मारोगे? Silicosis. Or mesothelioma will be associated. क्या मारोगे? Asbestosis. Do you have to think anything on this question? No. So whenever you see in first 50 questions, such type of questions where you just have to mark directly, go with these questions. So 50 questions is coming up on the screen. Go first, question 1 आ रहा है, mark करो. दूसरा लग रहा है नहीं आ रहा है. If you feel like the second question I'm not able to understand, I need the time to think on it, skip. Go to the third. Bouncer आ रहा है, fourth. So in first round, even if you will be able to answer 20 questions out of what? 50. ठीक है. But these 20 you know that they are correct. I don't need to think. They are what? Clear questions. देखा, मारा. Then go to the second round. Think about the questions. You have to two options. Okay? उन पे सोचो. Then come to the third round. अब जो बचा है, मारो. Now what happens in this way? For example, if the first question is hard, now you keep thinking. Eventually, the easiest one, the silly mistake, question गलत हो गया, hard हो गया. Eventually, anxiety level increase, nervousness increase. Time की ओर नजर आए. We end up by marking silly mistakes. Sometimes you will answer one thing. In the mind, you will say it is silicosis, but mouse पता नहीं asbestosis के पास क्यों जाता है. Yes, I am a foreign graduate only, na? I know these things. Nobody can feel you better than someone who has been in this exam. I am damn guaranteed, damn 100% sure. I have seen after my exams people coming up with a recall. ये question आया था. मैं 5 घंटे पहले दे के आया था exam. ये था ही नहीं वहाँ. Then teacher is saying, I think the examiner might have asked like this. अबे I was already there. पता है examiner ने नहीं पूछा था. The clinical case, the information they give 2 lines. अगर पूछना होगा ना most common type of pneumoconiosis silicosis, इसमें 10 लाइन छपा देंगे, पूरी स्टोरी भर देंगे उसमें, फिर लास्ट में पूछेंगे मोस्ट कॉमन टाइप विल बी. बट इफ ए क्वेश्चन यू नीड मोर इंफॉर्मेशन, उसमें क्या लिखेंगे? पेशेंट आ गया, उसको बुखार था, बोल तो उसका डायग्नोसिस क्या है. बुखार पे डायग्नोसिस मांगते हैं, फीवर पे. सो व्हाट आई एम सेइंग इज, whatever you are studying, whatever we are delivering, remember this, because this is most repeated things that will come in the exams. Okay, no matter, at some point you feel exhausted, because at this time of time you are studying from last 5 months, you are exhausted mentally, physically, emotionally, every way. अब तो वो जबरदस्ती वाला सीन चल रहा है, ठीक है ना? बट यस, अब इतनी मेहनत की है, लेट्स टेक दिस हार्ड वर्क फॉर द लॉजिकल एंड, है ना? आई नो यू आर टायर्ड, इवन आई एम टायर्ड, but is there any escape? No, there is no shortcut to this exam. There is no escape to this exam. There is no second chance. Sometimes it's now or never. So study, you're broke, you're mentally unfit. No, pado, ratta maro and get it done. ठीक है? चलो, enough motivation. Yes. Online people, wake up. Chalo. Now dial events of vaccines. Okay. Now you already know normal saline is a diluent for which vaccine? Yes. And yellow fever and dengue. There is a common causative agent between yellow fever and dengue. What is that? Group B arbovirus. What is that? Group B arbovirus. What's that? Group B arbovirus. Okay. Now, if I talk about a very different type of a diluent for which condition? Japanese encephalitis. What is the diluent? Phosphate saline buffer. Very good. What is that, sir? Phosphate saline buffer. Okay. And vaccines diluted with sterile water, distilled water, MR. Very good. That is going to be MR. Okay. So that's all about your vaccines. That's all about your vaccines. Now answer me this question. A 10-year-old child develops ascending muscle weakness 3 weeks after receiving the vaccine. The neurological examination shows areflexia. Which of the following vaccine is responsible? What is your diagnosis? Very good. GBS. The vaccine responsible is killed influenza. The vaccine responsible is killed influenza. Okay. अरे ए नहीं मारना है, मीजल्स वैक्सीन में बोला न्यूरोलॉजिकल प्रॉब्लम्स, बट आई एम मेंशन डायरेक्टली ए रिफ्लेक्सिया गोइज टू ग्लेनबियर syndrome. So GBS is caused by the side effect of which vaccine? Killed influenza. That's caused by which vaccine? Killed influenza. Remember, okay, intersusception is caused by rota virus. Measles में क्या होता है? What is the side effect of measles vaccine? Thrombocytopenia as well. What else? What else? What else? Toxic shock syndrome. Chalo, very, very, very important again. Some topics from the PSM pakka pakka question. Okay, these are all those topics जहां से आना ही आना है. And some topics nobody knows. Opinion based. Is there any inconsolable crime due to pertussis? No, no. A patient from different age groups from a village in West Bengal came to the clinic with the illness. On examination, it is noted that all of them were having what? Edema. On history taking, it was found that they were consuming mustard seeds from the same local shop. What is the most probable diagnosis? What is the most probable diagnosis? Yes, epidemic dropsy. Let's discuss all about these food adulteration diseases. Okay. Now, in these food adulteration diseases, before the question they used to ask is what? Food stuff and the toxin. Food stuff and the toxin. But now the question that they ask, they give a clinical picture that a patient was having cardiac failure, patient was having edema, patient is a case of hepatocellular carcinoma, patient is having neurolatherism, neuroparalysis, osteoparalysis, or the patient is having gangrene. So based upon clinical features, you have to answer the condition. Now, if I talk about the first food adulteration disease, that's going to be your latherism. That's going to be your latherism. And if I talk about the toxin that is associated with the latherism is BOA. What is BOA? Beta oxalil amino alanine. Beta oxalil amino alanine. Trust me, they will give in options beta oxalil amino acid, beta oxalo amino alanine, beta oxalo. They will make up their own things. Are you getting my point? So rather than mentioning what? Short form, always remember what? Full form as well. ठीक है ना? What is the agent? Kesari. The, and what is the food stuff? That's going to be yellow pulse. That's going to be yellow pulse. Okay. If I talk about second one, epidemic dropsy, what will be your toxin? Sanguine. Okay. What is the agent? Argemone seeds. And food stuff is mustard. If I talk about endemic ascites, pyrrolizidine. Okay. Pyro. If I talk about agent, Orotorula seeds. And the food stuff is millet. Very good. Then most repeated aflatoxicosis. That's going to be aflatoxin. Okay. And the causative agent is Aspergillus flavus. And food stuff is very good. Ground nut. Then the last one, ergotism. Ergot alkaloid. Ergot alkaloid. Okay. Agent is claviceps fusiform. Claviceps and the food stuff is flowering plants. Now, the most important thing about this food adulteration disease is what? Clinical features. Okay. Now, if we talk about the first one, latherism. Okay. Patient is having what? Osteoparalysis. Patient is having in the picture, kya hai? Osteoparalysis. Sir, in case of a latherism, the two clinical features, okay, patient will have. First one is neuroparalysis. And the second one is going to be osteoparalysis, neuroparalysis and osteoparalysis. Okay. The number second point, epidemic dropsy. In epidemic dropsy, the patient will have a complaint of bilateral swelling of the legs, bilateral swelling of legs. Along with that, patient will have diarrhea and dyspnea and cardiac failure. This was your PYQ, right? This was the question asked, edema, cardiac failure. What is the toxin associated? What is the toxin, bacho? Yes? What is the toxin? What is the toxin? Sanguine. Then endemic ascites. Ascites, वहीं से दिया हुआ है, तो what will be there? Jaundice and ascites. What will be there? Jaundice and ascites. Then ergotism, vasospasm, gangrene. Vasospasm, gangrene. Now, I will tell you the clinical features of this condition. You will tell me the cause it. You will tell me the food adulteration disease. Is that clear? Yes. Is that clear? Now, first recall with me the toxins. I will tell the toxin. You tell me what? You tell me the condition, disease. Right in aflatoxicosis, hepatocellular carcinoma. They will give this history. Okay. Hepatocellular carcinoma with what? Aflatoxicosis. Chalo. Now tell me, fast, fast. BOA, 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 ergot alkaloid, ergot alkaloid, ergot alkaloid, sanguine, 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 pyrrolizidine, 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 aflatoxin, aflatoxin. Now tell me, osteoparalysis, 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 gangrene, ergotism, gangrene, gangrene, hepatocellular carcinoma, hepatocellular carcinoma. Now, my opinion, if a question will come, for example, he will give a clinical case, and in question, he's mentioning what is the marker of hepatocellular carcinoma? Alpha fetoprotein. Yes, alpha fetoprotein is also the marker for what? Hepatocellular. He will say AFP is increased. Which food adulteration disease you will mark? Aflatoxicosis. Yes or no? Yes. So integrated. He will mention that there is a gangrene, amputation is done. Kya ergotism. Are you getting me? He will mention that patient died of a cardiac failure. He will mention patient had an increased SAG. Are you getting my point? Albumin, ascites में दिखते ना. What is your jaundice and ascites goes to? Endemic. As he will mention there are some neurological problems with unable to walk. Latte. Is that clear? Is that clear? Now food stuff. Fast, fast. Flowering plants. Groundnut. Millet. Kesari dal. Lathyrism. Mustard. Is that clear? Is that clear? One question from food adulteration disease will come. Is that clear? Chalo, next. Answer me this question. Then I'll go back to that. Groundnut, moment you saw the groundnut. Lathyrism toxin. BOA. Food stuff. Kesari, yellow pulse. Ergotism. Ergot, alkaloid. Food stuff. Flowering plants. Epidemic dropsy. Food stuff. Very good. Is that clear? Is that clear? Yes. More focused on what, my dear students? Clinical features. See, toxins, you will get it. Are you getting my point? But you have to find what? You have to remember what? Clinical features. That's how they ask. Now, how you will prevent this? Yes. First of all, removal of toxins. How we can remove the toxins by? Steeping method or parboiling. ठीक है ना? Then you can also what? Start which vitamin prophylaxis? Vitamin C prophylaxis. They can ask, out of which of the following is incorrect about the prevention and control of the food adulteration disease? Option में देंगे vitamin E prophylaxis. What is your answer? That one only. Because which vitamin is used for the prophylaxis? C. That's how questions are being made up. So many platforms. Are you getting my point? MCQs, you have to change. You have to ask something different. So I'm used to with these MCQs and all. I'm already telling you all the MCQs. What are the MCQs coming up? What if the same comes? Okay? चलो या तो क्या कर सकते हो ban the crop ठीक है ना either से ban the crop or you have to aware and educate people about the aware or educate people about the disease about the disease that's all about your food adulteration disease that's all about your food adulteration disease is that clear to everyone yes next all clear so far yes? Anyone, any doubts? Chalo. So which kit you will recommend for the treatment of a 20-year-old female who has recently engaged in a sexual intercourse and is experiencing a vaginal discharge? When following... Okay. पहले पढ़ दूं पूरा? When following the syndromic management approach for the sexually transmitted infection at Suraksha Clinic at the local primary health center. Yes, sir. The answer is green. Kit 2. Chalo. Now, Suraksha Clinic. Now, what exactly is this Suraksha Clinic? Now, listen. This Suraksha Clinic is a service that was launched in order to give what? A medication to the medications to the people having sexually reproductive tract infections or sexually transmitted infections. Is that clear? Now, how this works? Now, if a patient is coming to you, for example, patient is having which discharge? Vaginal discharge. Now, yesterday we studied in OB-GYN different types of discharge. If a patient is having curdy discharge, what is your answer? Candidiasis, patient is having green discharge. Trichomoniasis, patient is having frothy, white, creamy discharge. Vaginosis, bacterial vaginosis. But when a patient in Suraksha Clinic, as per them, a patient is coming to you, you're not treating based upon the diagnosis. You're treating based upon the symptoms. So patient is telling you, sir, I have what? Discharge from the vagina. I have a discharge. What you will give? Directly kit green. Are you getting my point? Irrespective of what? Diagnosis. So treatment is based upon symptoms, not on the diagnosis. Any patient coming to you with a complaining of PID, I will prescribe this kit. Okay. Now, what are these kits? These kits have a different medications inside each kit. We have different colors, and inside each kit, we have what? Different medications. So far, we had only 7 kits, but new update, we have one, which more kit? Brown kit, 8th kit. What is change in the brown kit? Anorectal discharge. Before anorectal discharge was going into which kit? Gray color. Yes, kit 1. But now anorectal discharge will go with the kit 8. That is which color? Brown color. Now let's study all the sign and symptoms of each kit and in which conditions they are being prescribed. Okay. Now, if I talk about the Suraksha Clinic, I've already told you the treatment is based upon what? Symptoms, not on the diagnosis. That's why it is called what? Syndromic approach to the patients. Okay. Now, if we talk about the kit 1, that is which color? Gray color. Okay. And gray color kit. Yes, write it down. Gray color kit. We have which discharge? Urethral discharge. Or you can write down cervicitis. For cervicitis also we are giving what? Kit 1 gray. Okay. Sometimes they will play in the options. Remember, one is what? Gray. They will write in options. Patient is having which discharge? Urethral discharge. Which of the following kit is prescribed? Kit 1 gray, kit 2 gray, kit 3 green, kit 5 red. So they will give gray in 2 options. But remember, one is with gray color. Okay. Then kit 2. Which discharge? Vaginal discharge. Yesterday we studied about different types of vaginal discharge. Can you tell me Amsel's criteria is used for which type of vaginitis? Bacterial vaginosis. Nugent score. Bacterial vaginosis. Recent PYQ. Nugent score for bacterial vaginosis. Strawberry vagina or colpitis macularis. Trichomoniasis. Is that clear? Metronidazole is a drug of choice for 2 conditions. Trichomoniasis. In which of the following partner is treated as well? Is that clear? Trichomoniasis. Is that clear? All of the following have an alkaline pH except candidiasis. Candidiasis have which type of pH? Candidiasis have which type of pH? Acidic pH. Is that clear? Candida is caused by Candida albicans. Bacterial vaginosis is caused by Gardnerella. And trichomoniosis is caused by Trichomonas vaginalis. What is the oral treatment for candidiasis? Clotrim. Oral is fluconazole, but topical is clotrimazole. Is that clear? Yes. Is that most common vaginitis is bacterial vaginosis. Most common vaginitis is bacterial, which mycelia is responsible for what? Invasion and attachment of bacteria into the vaginal epithelium. मैंने कल बोला था ना mycelia. Who is responsible? Mycelia in candidiasis. Is that clear? Then trichomoniasis, you might have seen those pictures. है ना? वो picture कर लेना. That is all about what? Bacterial vaginosis, trichomoniasis and candidiasis. Remember this Nugent score. ये अभी recent NEET PYQ में आया था. Just they asked this one. Nugent score is calculated in, or Nugent score is done for. What is your answer? Bacterial vaginal. Amsel's criteria, bacterial vaginosis. Then kit 3, WBR. I have repeated the same things in every class. White, blue, red is also discoloration in which condition? Raynaud's phenomena. Your question was asked that what is the order of discoloration in Raynaud's phenomena? White, blue, red. And what is the drug of choice or drug treatment? Calcium channel blockers. Calcium channel blockers. Raynaud's phenomena. And now tell me, white, red, blue, and red, they are all for genital ulcers. Now, depending whether the genital ulcer is hepatic or non-hepatic. So write it down, WBR, genital ulcers. Genital ulcers. Genital warts are caused by which HPV? 6 and 11. Very good. Now you have a patient with genital warts called as condyloma acuminata in pregnancy. है ना? Whatever comes in pregnancy, I take on my head. Why? OB-GYN. ठीक है ना? So tell me the treatment. Huh? हाँ, pregnantly. Very good. What's the treatment? Cryotherapy. But if it's normal, good. Treatment for anogenital warts. Condyloma acuminata. Pregnancy, he said cryotherapy. Yes, anyone? जैन साइक्लोविर तो कहाँ गई तू? CMV में चले गए आप? Cytomegalovirus is Jan cyclovir. Acyclovir. Yes, it started with I. It started with I. Anyone in the ivermectin? No. चलो, tell me no later. कुछ तुम लोग भी करो, कुछ हम भी करेंगे. Next, genital ulcers. First, non-hepatic. But non-hepatic is responding to penicillin. Then genital ulcers. Resistant or allergic, कुछ भी लिख दो. Resistant to penicillin. Then genital ulcers hepatic. You already know. What is the drug of choice? Yes? Acyclovir. चलो लिख ही देता हूँ यहाँ पे. Acyclovir. Is that clear to everyone? Yes. Then we have yellow color. है ना? Lower abdominal pain. What is the triad of PID? Cervical tenderness, adnexal tenderness, abdominal tenderness, है ना? Then chlamydia and gonorrhea is the cause of what? PID. And this PID is the most common cause for ectopic pregnancy, also called as salpingite systemic nodosa. Is that clear? Yes. So any patient coming with the lower abdominal pain, you think of PID. Which kit you will give? Yellow color kit. Black color with inguinal bubo. What's that? Inflamed Inflamed lymph nodes. That is inflamed lymph nodes. And kit 8, the new update is going to be brown. What is that? Anorectal discharge. What are the medications? Doxy and cefixime. Is that clear? Doxy and cefixime. Okay. What is the medication in the gray color kit? Azithromycin and cefixime. What is the medication in the green kit? Fluconazole and yes, fluconazole and signidazole. Is that clear? What is the medication inside the white color? White is responding to penicillin. So penicillin and azithromycin. Penicillin and azithromycin. What is the medication in the blue? Resistant to penicillin. That means doxycycline and azithromycin. Very good. Doxycycline and azithromycin. Red color you already know, my dear students. What is that? Acyclovir. Anyone left? Yellow color. Yellow color, 3 antibiotics. Cefixime, metronidazole and doxycycline. है ना? Yellow में लिख दो. Cefixime, metronidazole and doxycycline. Is that clear? Now it is all about what? Suraksha Clinic. Okay, and this Suraksha Clinic, it is giving a treatment based upon treatment. Yes, imiquinone. Imiquinone is a drug that we use for what? Condyloma acuminata. The cryotherapy is your recall question, FMG. Based upon treatment based upon imiquinone is, guys, the drug that we use. Treatment based upon symptoms, not on diagnosis. That's why it's called as syndromic approach. Okay, all the PYQs. Okay, now last time if they asked the treatment in the pregnancy for acuminata, this time they can ask in the normal people. Are you getting my point? Question तो पूरा repeat होगा नहीं, exact repeat नहीं होगा, but उसी के आसपास it will be in the radar. Okay, now color kits are cleared. All the people out there, color kits are clear. Yes. Chalo. Yes. Now I will tell the symptoms and you will answer me fast. What? You will answer me the kit. Okay, you will answer me the kits. Tell me, anorectal discharge, vaginal discharge, herpetic genital ulcers, red herpetic genital ulcers, cervicides, abdominal pain, inflamed lymph nodes. Very good. Now you have a question coming to you. A patient as a diagnosis of what? Having any urethral discharge. Which of the following medications you will give? Azithromycin plus cefixime. Because you know that the kit I have prescribed to 1 and kit 1 has a medication. Is that clear? So either they will ask the symptoms, you will answer the kit. Either they will ask the symptoms or the medication inside the kit. And the update is kit 8 brown. Okay, update is kit 8 brown. Clear? Chalo. Antibiotics again, right? Kit 7. Azithromycin and doxycycline. 7 नहीं लिखा हमने? Black. Right. Azi and doxy. Azithromycin belongs to the which class of drug? Macrolides. है ना? Doxy. Tell me which antibiotic inhibit 30S ribosome. Only 2 class of antibiotics. Aminoglycan and one more. Starting with T. Which class T? Tetracyclines. Very good. Now 80 at 30. Rest all. Remember, see, at 30. 80 aminoglycoside T is tetracyclines 30. Rest other 50S. ठीक है ना? ऐसे आ सकता है question. Okay. Aminoglycosides. What is the side effect? Autotoxicity. Need PG recall question. The most common or the most severe autotoxic aminoglycoside is kanamycin. This can be the question. Most autotoxic aminoglycoside is kanamycin. Okay. Streptomycin also belongs to what? Aminoglycoside. They are the injectable drugs. Tell me, they are the injectable drugs. All the aminoglycosides, they are what drugs? Injectable drugs. Now tell me, streptomycin is a drug of choice for which condition? Rats. Rat, I gave the hint. Leptospirosis. And for the prophylaxis of leptospirosis, toxicide. है ना? तो याद रखना, leptospirosis. What is the test we check? We check the leptospirin in urine and blood. है ना? Now my question to you, leptospirosis, what is the agent? पूरा बता दो. Yes, you are right, but you have to answer fully ना. Groundnut. Rat urine. Okay. लिख दिया एक ने. L interrogans. What is the answer? L interrogans. Okay. For brucellosis, they will answer faster. For brucellosis, we have B. melitensis. For brucellosis, we have B. melitensis. What are the two tests that we do for brucellosis? Rose Bengal test and milk ring test. What are the two tests? Rose Bengal test and which test? Milk ring test. Membrane filtration test is done for filariasis. RK39 dipstick test is done for Kala Azar. Leishmaniasis. One peripheral blood smear thick in the night. Filariasis. Two peripheral blood smears, thin and thick. Malaria. है ना? Malaria. Any more test? Histidine rich protein. Histidine rich protein. Rapid antigen test. Malaria. ठीक है ना? All these. See, all the tests. Today, in the end, I will give you a table. All the agents, all the vectors, and their causative diseases. Okay, and all the tests in where? PSM. The good point is all these conditions are repeated in where? Your microbiology as well. Is that clear? So माइक्रो में भी रिपीट हो रही है, डर्मा में भी रिपीट हो रहा है, मोस्ट ऑफ द थिंग्स. पीडियाट्रिक्स, नाउ मीजल्स, पीडिया में भी पढ़ा, पैथो में भी थोड़ा पढ़ा, माइक्रो में भी पढ़ा, पीएसएम में भी पढ़ा. नाउ मीजल्स के क्वेश्चंस आने के चांसेस ऑब्वियसली ज्यादा होते हैं. सेम मम्प्स, रेबीज, रुबेला हो गया. सो दीज आर द इंपॉर्टेंट कंडीशंस. चलो, तो डॉक्सीसाइक्लिन से याद आ गया था, लेप्टोस्पाइरोसिस. ओके, केएफडी, विच वायरस? केएफडी, कायनोसुर फॉरेस्ट डिजीज, पढ़ा है ना पीएसएम में? हाँ, वो तो टिक हो ना. कॉजेटिव, कॉजेट एजेंट तो वेक्टर हो गया ना. ग्रुप बी आर्बो virus. Now, what are the conditions we have group B arbovirus agent? Number one is KFD. Number second is yellow. Number third is dengue. Number four is Japanese encephalitis. Yes or no? All these conditions क्या है? Group B arbovirus. Please remember, group B arbovirus. Yellow fever, dengue, Japanese encephalitis and KFD. अब भूलेगा तो नहीं? All these conditions क्या है? Group B arbovirus. Measles के लिए? Measles? Which virus? Measles, RNA paramyxovirus. Influenza, orthomyxovirus. अब लास्ट बता दो, रुबेला. Started with T. टोगा वायरस. एंड इसके लास्ट बता दो, लिस, मैंने बता ही दिया, लिस्सा वायरस फॉर मम्स, रेबीज. ठीक है ना? These causative agents are very important. Clinical case, आप लोगों ने पीएसएम में टीएनडी में भी किया है क्वेश्चन. Patient of this patient of congenital rubella syndrome, having a cataract, having a cardiac defect, and having a SNHL, है ना? CCD है ना? Triad. Cataract, congenital heart defect and deafness. What is the causative agent? Virus किस class का है? Yes, what is the virus, guys? CCD. What is the virus? Yes, what is the virus? Toga virus. Lissa for rabies. Lissa for rabies. Lissa for rabies. Now I will tell the condition, you will tell me the viral. Is that clear? Is that clear? Now tell me, Toga virus. Toga, Lissa, orthomyxovirus, RNA paramyxovirus, and Japanese encephalitis, yellow fever, dengue, KFD. Group B, arbovirus. Is that clear? Yes, it is boring, but you have to remember anyway. 149 is equal to 150 is equal to एक ही बात है भाई, याद रखना. चलो, which type of cancer won't be affected in a patient using OCP, which is a protective factor for endometrial cancer? Okay, patient having breast cancer to increase karega. Now we have OCPs, which will increase some cancers and which will decrease some cancers. Okay, combined OCPs. Combined OCPs where we have estrogen plus progesterone. Very good. Which estrogen we have? Yes, ethinyl estradiol. And which progesterone? Levonorgestrel. We have a combined drugs, Mala and Mala D. Mala and Mala D. One is 3 rupees, another is free. That is the difference. Composition is same. Okay. Now this Mala and Mala D, you already know, sir. It is ethinyl estradiol. पूरा लिख देता हूं मैं. पता नहीं क्या समझोगे. Ethinyl estradiol. So it's ethinyl estradiol plus levonorgestrel. Levonorgestrel is what? Progesterone, second generation. Is that clear? Now, this ethinyl estradiol is how much? And this is 150 micrograms. This is 30 micrograms. Okay. Now, OCP increase some cancer. One question will come, most common cancer associated with the OCP. Your first answer is going to be hepatic adenoma. So, right, first one, sir, hepatic adenoma. So, first one is going to be hepatic adenoma. Second one is going to be which cancer, bacho? Cervical cancer. Okay. Yesterday, we did not discuss anything about cervical cancer. Yes? Okay, na? So, let me tell you brief cervical cancer fast. Cervical cancer is caused by HPV. Which one? 16. And if you have to choose one, what you will choose? 16. Is that clear? Now, what are the symptoms of a patient having a cervical cancer? Postcoital bleeding. Along with that, patient will have pyometra, foul smelling, discharge. Patient will have a weight loss and the pain, cancer, cachexia. And the pain, cancer, cachexia. What are the people who are more prone to the cervical cancers? Sex workers. Okay. One more, low socioeconomic status and early intercourse. Okay. Or multiple sex partners. Okay, or patients with STDs. Is that clear? Now, sir, a patient is coming to me and we have a one classification called as which classification? Bethesda classification. What is the Bethesda classification? It tells me about how many cells have a dysplasia. Okay, if less than 1/3 cells have a dysplasia, I call it as CIN1. If more than 1/3 and less than 2/3, CIN2. If more than 2/3, all the cells, carcinoma in situ, CIS. Now, depending when a patient is coming to me, the first investigation we do is called as pap smear. And pap smear is done with a spatula called as Aries spatula. So I take this pap smear, I take this smear between an endocervix and ectocervix. There is a zone called as transition zone. What is this transition zone? This is a zone where the cells are continuously multiplying, dividing, and that's why this zone is more prone to what? Infections. So after CIN1, I did pap smear for CIN1. How many cells are having dysplasia? Less than 1/3 cells. Okay, and when less than 1/3 cells, I will give patient antibiotics, antivirals, and ask for the follow-up continuous surveillance. Is that clear? But when the cells are more than 1/3, I have to go for what? Colposcopic biopsy. And now colposcopic biopsy I can done two ways. Either I will use what? I will use Luger's iodine or Schiller's iodine, or either I will use acetic acid. It is called VIAA, visual inspection under acetic acid, or VILI, visual inspection under Lugol's iodine. Are you getting my point? After that, first you will take the biopsy from which areas? Unstained areas. Then second, first you will take stained areas. Then second, you will stain from unstained areas. But it will be coagulated and all. Then it will give maho gray appearance and aceto white appearance. You already know that. Okay. Then the treatment depending on whether it is invading the stroma or whether it is not invading the stroma. It is invading the stroma, radical hysterectomy. It is not invading the stroma, leap or leads. Excision and a large loop excision of a transition zone. That is leads. Is that clear? Yes. Now, what is the most common cause of death in case of? So, ye bata de? Uremia. Second is sepsis. Third is hemorrhage. Is that clear? That is all about what? Cervical cancer. So, postcoital bleeding. You have an idea the patient. Now, you have a patient coming to you with a postcoital bleeding. What is the next step? What's the next step? Colposcopic biopsy. Why you will go with the colposcopic biopsy? Because patient is already symptomatic. Should you go for pap smear? No, pap smear is a screening test. You have to go for a diagnostic test. Is that clear? Yes. Any more thing important in cervical cancer? No. Then you have a vaccines. है ना? Bivalent, 16, 18. Quadrivalent, 6, 11, 16, 18. Then the 9 ones. Okay. Nonavalent. Okay. Chalo, cervical cancer. Anything else? Now you have a patient coming to you. Patient is obese and hypertensive. Okay. Patient has a blood pressure of 160 by 90, 150 by 90, and patient is having a cholesterol level of 230, having a cholesterol level of 230. She's coming to you. You are a doctor. Doctor, I'm having a postcoital bleeding. What are you suspecting? What are you suspecting? Endometrial cancer. Why? Because obese, hypertensive, and diabetic is a classical case with postcoital bleeding of endometrial cancer. Is that okay? Can endometriosis cause endometrial cancer? No. Endometriosis is endometrium somewhere else. That cannot cause the endometrial cancer. So what are the factors going to endometrial cancer? When we have a hyperestrogenic state, and there is a one classical drug that causes an endometrial cancer called as tamoxifen. This tamoxifen has been asked multiple times. It belongs to the class of a drug called as SERM. SERM. Now, rather using tamoxifen, this drug we also use in which cancer? Breast cancer. Rather using tamoxifen, we can use raloxifene. And that raloxifene also used in osteoporosis. But was it a drug of choice for osteoporosis? What's the side effect of bisphosphonates? Yeah. Esophagitis. है ना? Esophagitis. And you have to tell the patient that take this drink, take more water after taking what medication? Bisphosphonate. But if a patient is a female, there is no menopause, you will give estrogens. Last question to you. Which rank ligand inhibitor is a drug that you use in a patient having osteoporosis? Rank ligand inhibitor. Bata do. Online people. A, B, C, D. D for? Very good. Denosumab. D for? Denosumab. This is a rank ligand inhibitor used in osteoporosis. And the investigation of choice is going to be bone DEXA scan. Is that clear? Is that clear? अब लिखे चलो cervical cancer से कहाँ पहुँच गए हम हड्डियों में. Next one is going to be breast cancer. Let's revise breast cancer a little bit, okay? Breast cancer. What's the most common gene? Mutant? P53. Most common overall is going to be P53. You have a patient coming to you with a discharge, greenish discharge, duct surgery, duct ectasia, microdotectomy, है ना? But if it is a duct papilloma, had failed phase surgery. It's a had failed surgery. ठीक है ना? If there is a thrombophlebitis of the breast, what is your diagnosis? Mondor's disease. Thrombophlebitis of the breast is Mondor's disease. Okay. Okay, now this question. It's a very good question. Now you know that this breast cancer goes to the ovaries as well, called as Krukenberg tumor. Have a signet ring cells. Which breast cancer goes to the which breast cancer goes to the ovaries, causing what? Krukenberg tumor. Now, this Krukenberg tumor is a secondary to ovaries, है ना? It comes from either breast cancer or the stomach cancer, right? Now, my question is, which breast cancer will go to the what? No problem. Tell me later on. कुछ तुम लोग भी करोगे, कुछ हम भी करेंगे. Symbiotic relationship, right? अरे symbiotic relationship. Something you will tell, something I will tell, है ना? चलो, मैं बता दूंगा, कोई बात नहीं है. थोड़ा सस्पेंशन होने दो. Online people, see, I told you, I will play sometime. They know all these questions that I have asking, but sometimes I need to change the things. Why? वो same ही हो जाएगा ना. चलो, decrease. Decrease which cancer? Endometrial cancer. Okay. Now this endometrial cancer, it's increased by tamoxifen. Very good. It belongs to the which class of drug? Some. So rather tamoxifen कौन सा use? Reloxifene. सही है ना? Okay. Now we have a drug that can be used in a contraception up till 120 hours. What is the drug? Ulipristol. Remember that is SPRM, selective progesterone receptor modulator. ठीक है ना? Up till how many hours? 120 hours. Okay. Ulipristol. Ulipristol. What is the dosage? 30 तो है, आगे बता दे. 30 mg, not 30 micrograms. चलो. Good. 30 तो याद रखा है. नहीं नहीं अजित. चलो. Ovarian cancer. Okay, it can decrease the which chances of which cancer? Ovarian cancer and uterine cancer. And uterine cancer. Sir, what does this tamoxifen do? It causes endometrial hyperplasia. I will come to that point as well. Tension nahi lo. Endometrial hyperplasia. है ना? Now, one question was asked in your exams that out of which of the following is not a hyperestrogenic state? को रट लिया है ना, लो बीएमआई है ना. वेरी गुड. ऐसे ही रटो, मैंने भी अपने टाइम पे रटा था ना. आंसर ही याद रखा था मैंने. व्हाट इज द आंसर? लो बीएमआई. व्हाई? बिकॉज कोलेस्ट्रॉल इज अ प्रीकर्सर फॉर एंड्रोजन्स. अब जब लो बीएमआई होगा, व्हाट विल बी द लेवल ऑफ कोलेस्ट्रॉल्स? कम. व्हाट विल बी द लेवल ऑफ एंड्रोजन्स? कम. हाइपो ईस्ट्रोजेनिक स्टेट. ऑप्शंस में टेमोक्सिफेन भी दिया है, but tamoxifen is a hyperestrogenic state. That's why it is causing endometrial hyperplasia, because you know, for the proliferation of endometrium, which hormone is used? Estrogen. Is that clear? Is that clear? Chalo, next. Now, sir, contraindications of a what? OCPs. Now, you know these contraindications, all these conditions. Patient having any breast cancer or family breast cancer, patient having history of cervical cancer, or patient having history of hepatic or liver disease. Can you give this drug? No, because they increase the incidence of these cancers. So write it down. Absolute contraindication, sir, liver disease. It also causes hepatic hemangioma as well, but more go with the hepatic adenoma. Okay. Sir, pregnancy. Okay. CVD, cardiovascular disease, or thromboembolism. Or thromboembolism. Okay. Then relative contraindications. Age less than 40. You have patient having any renal disease, patient having diabetes, migraine, and hypertension. And hypertension. Clear? Clear, bachcho? Yes, sir. So, next. Contraception is very, very important. Very, very important. Huh? बता दो, what is the absolute contraindication for the device depicted in the image below? Sarkari question, what is the image? Which generation? First, second, third, fourth? Lifespan. 10 साल. अब बता दो, which of the, what is the absolute contraindication for the device depicted in image below? Absolute. They all are contraindication, but you have to say absolute contraindication. Vaginal bleeding. Okay. Abnormal vaginal bleeding. है ना? Abnormal or vaginal bleeding. See, any bleeding other than the normal menses is abnormal uterine bleeding. Any bleeding other than what? Normal menses is an abnormal bleeding. So if a patient is bleeding, undiagnosed bleeding, patient is bleeding with an unknown cause, what is your answer? It's an absolute contrast. It's a AUB. Are you getting my point? Now let's discuss about first what are these called as intrauterine contraceptive devices. Okay. Now intrauterine contraceptive devices you have. Now my dear students, we have how many generations? What is the first generation? Lippes loop. Simple image. Previous exam. What is the image depicted? What was that? Lippes. Second, we have copper containing. Copper T380A or copper T200. Third generation, we have hormones containing. What are the hormones? Mirena. Which hormone? Levonorgestrel. Having a lifespan of fourth generation, we have. Fourth generation, we have Flexigard. Fourth generation, we have Flexigard. Are you getting my point? So these are all good IUCDs. Now, either they inhibit the ovulation or either they make the cervical mucus thicker or they prevent fertilization. This is the mechanism of action of these IUCDs. But the most important question that they can ask is a contra indications and the side effects. And the side effects, simple NEET PG question was asked. A patient had an IUCD failure. What is an IUCD failure? Patient had IUCD inside, but still patient got pregnant. What will be the next step? Continue. Remove the thread. Remove the. If you are not able to locate, go for the investigations. USG, X-ray, hysteroscopy, laparoscopy. Sir, if this IUCD is found in the uterus, how do you remove? Hysteroscopy. After investigation, it is found outside the uterus. Laparoscopy. Got it now? Inside the uterus? Outside the uterus? Your FMG previous year recall question was asked, a patient had a IUCD, patient implanted an IUCD inside, followed by which patient complained of a heavy bleeding. What is the most common side effect? Menorrhagia, heavy bleeding. What is your management? Nothing. Reassurance plus vitamins, folic acid. But now if she's coming with pain, pain क्यों हो रहा है? Infection. What is the management? Remove the IUCD and start antibiotics. These two scenarios, remember. If pain is there, infection is there, remove antibiotics. If only heavy bleeding is there, what you will do? Reassurance plus folic acid. Is that clear? Then the absolute contraindications and the relative contraindications. What are the absolute contraindications? First, suspected pregnancy. Okay, then, yes, active PID. Third, undiagnosed bleeding or abnormal uterine bleeding. Okay, what's fourth? Ectopic pregnancy. Yes, that is a absolute contra, because ectopic pregnancy can be also caused by what? Use of IUCD. Relative contraindications. First of all, what is the most common side effect of IUCDs? Bleeding. Now, if the patient is anemic, can we use? No. Already bleeding or zyada. Second, patient is having any fibroid, because fibroids can go bigger, bigger, bigger. They can suppress this IUCD, they can perforate. Are you getting my point? Third condition, patient is having any uterine malformation like septate uterus, bicornuate uterus. Are you getting my point? And third, history of PID. Patient had a history of PID. These are main what? Absolute contraindications and relative contraindications. Clear? IUCD, lifespan of Mirena 5 years, lifespans of copper T is 10 years. Is that clear? Most important question, patient is after that. Now, after that, once you remove the thread, you have to ask the patient, do you want to continue the pregnancy? If yes, tell her there are 50% chances of the abortion. If no, go for the medical termination of pregnancy. And the question for contraception failure, you can go for a MTP up till how many weeks? 20 weeks. 20 weeks. 20 weeks. And 20 weeks, one doctor opinion is needed. 20 to 24, two doctor opinion is needed. Is that clear? Is IUCD clear? Contraception, very, very, very important. OCP and IUCDs are very, very important. Chalo, can we write? What is the regime that we use for combined OCPs? USP and Lancy regime. ठीक है ना? Then 4, there should be a gap of 8 hours within 72 hours. Okay, so remember that 4 plus 4. But if you are giving progesterone only pill, बच्चों, if you are using 2 tablets, that is 0.75 each. Gap should be 8 hours within 72 hours. But if you're using 1, then 1.5 mg. Because 2 is 0.75 plus 0.75. It's called 1.5. ठीक है ना? But अगर एक ही है तो 1.5. But usually अभी क्या दे रहे हैं? Coming up only 1. Is that clear? Is that clear? Next question. OCPs are contraindicated in lactation because they will suppress the lactation activity. Okay, sir, how long? If she is lactating 6 months, if she is not lactating 6 weeks. ठीक है ना? ये प्लैब का क्वेश्चन है. 6 weeks. ठीक है? Is that clear? What is the contraception that we use in the lactation? Progesterone only pills. है ना? Progesterone only pills. Is that clear? Is that clear? Now one more question from the contraception. Saheli. What is the drug used? वो तो नाम है सेंट्रोक्रोमेटिन, ड्रग थोड़ी है. ये बता दिया. Ormeloxifene is belong to which class of drug? SERM. Ormeloxifene belong to which class of drug? SERM. Today tablet, today आता है ना, उसमें क्या होता है? Non-oxynol 9. My time question. Today picture was given. What is inside? Non-ox. What is non-oxynol 9? Spermicidal gel. Least effective. Spermicidal gel. Non-oxynol. More effective. IUCDs. है ना? IUCDs. Is that clear? Anything else from OCPs? No. Anything else from contraception? Permanent methods, tubectomy and vasectomy. In tubectomy, you go for the polymerized procedure. You cut the fallopian tube and ligate. Vasectomy. Vas deferens is cut and ligated. You advise the patient no intercourse or use barrier methods. For how many months? 3 months. Or how many ejaculations? Or what is the most common cause of failure of vasectomy? Misidentification of vas. और कुछ contraception में? DMPA is used in which one? Antara. Kal hi bola maine. 150 mg once every 3 months. Then we also use one depot formulation called as netin, non-ethisterone enanthate, 200 mg once every 2 months. Is that clear? Then we have implanon and nexplanon. We, with the help of a surgical procedures, we implant them under the skin and they'll be releasing 35 mg LNG accordingly. Okay. We have 1 rod, we have 2 rods, and we have 6 rods. Okay. But the best one is implanon. ठीक है ना? Or nexplanon. Is that clear? Clear? Anything other? Any other contraceptive method? Which one? OCP. Within 72 hours you have to use. Okay? OCPs. But uliprostol is a drug can be used up to 120 hours. Okay? It belongs to the class. It belongs to the class. Which one? SPRM. It belongs to the class SPRM. Then barrier methods, you already know. The advantage of these barrier methods is they prevent sexually transmitted disease. And in order to increase the efficacy of these, we have a spermicidal gel inside. And if there is a contraception failure, which index? Pearls index. है ना? And couple protection rate, you already know, number of eligible couple using contraception. CPR, goal is 60%. Currently it's around 57, 58. Okay, before it was 55, now it's around 57, but goal is 60%. और कुछ contraception में? और तो कुछ नहीं है भाई. इतना ही बताए. It's a classical term, migraine. Is your typical term? And I'll check. हाँ वो तो contraindicated है ना, वो तो absolute है. You mean a particular name for the migraine, ना? I'll check. इसी मुझे याद नहीं है. Migraine. Anyway, less likely, less likely, less likely. Main hepatic adenoma. Okay. Now, I have seen a case where I see a 32-year-old lady having hepatic adenoma due to what? OCPs. Okay, OCPs because you need to take continuously and metabolize by the liver. At some point, नहीं कर पाता है. So best contraception method other than Mirena, not less likely very side effects. Are you getting my point? Very less likely IUCDs, but rather giving hormones because you already know the story of estrogen, what is doing to the body, progesterone. But now when you are giving something from the outside, now we have a physiological process in our body going on. At 14 days, proliferation is taking place. Then normally progesterone is coming. Now, if a female is in the second, third day of the cycle, or after post-cycle, she's having, for example, fifth day of the proliferation phase. Normally, progesterone to aega nahi. When you are giving a sudden progesterone in an emergency contraception, what is happening? Irregular menses. Are you getting my point? Artificial. And then it takes a long time for what? Process a normal cycle. But then after you giving these contraceptions or OCPs or the outside estrogen and progesterone, is she going under the normal cycle? No. You cannot predict ovulation. Are you getting my point? Now there are different tests to predict ovulation. There's a one test. What is that called? Spin Barker stretchability test, and that gives on dying a ferning pattern. Okay, simple question: which of the following hormone is responsible for fern pattern? Estrogen. Estrogen is thin, and thin. Okay, thick is pro. That is why why during the time of progesterone secretory phase, when you go and intercourse, it will prevent fertilization because it will be difficult for sperm to traveling in a thick medium. Is that clear? An image was given. Okay, image aega. This will be the image. This can be the image that they can okay, this image they can ask. This image is due to which hormone? बस image देंगे, क्या मारोगे? क्या मारोगे? Then we have a natural methods as well, depending upon the, but natural methods is for people who are educated and having a normal cycle. And also during ovulation, the temperature is increased by 0.5 Celsius degrees. So they can predict what patient is having ovulation. And yesterday I told you that there is a classical pain during the time of ovulation. What is the name of the pain? Mitchell-Marsh pain or mid-cycle pain. Is that clear? Enough contraception. Chalo. IUCD and its contraindications. Let's write. Now, either, sir, let me write here. Chalo. Sir, patient IUCD. Can we write in short form so that, yes, Anna, short form. Most common side effect first is going to be Meno. What is menorrhagia? Bleeding more than 80 ml. Sir, there is also one more disorder patient can have. Patient can bleed frequently. What is that called? Very good. Polymenorrhea. Okay, when we say polymenorrhagia, that is along with that. Okay, heavy bleeding plus frequently. Polymenorrhea when the cycle comes less than 21 days. Oligomenorrhea more than 35 days. Hypomenorrhea less than 2 days or 10 ml of blood. Is that clear? Okay, less than 2 days bleeding or 10 ml of blood. Normal amount of blood is 30 to 35 ml, but more than it is menorrhagia. Okay, my question to you: a patient is coming to you. Patient is saying, doctor, I did not bleed for 2 months or 3 months. Followed by that, right now I have very menorrhagia, heavy bleeding. What is your diagnosis? PCOD में तो मिनिमल होता है वो ischemic withdrawal की वजह से artificial. It is metropathica hemorrhagica. Metropathia hemorrhagica. Having which type of endometrium? Swiss cheese endometrium. You might have studied in your gynecology. Is that clear? Yes. Chalo. Next. IUCD and the contraindications. Now we have a IUCD absolute contraindications. Okay. Or we have relative contraindications. Either we have what? Absolute contraindications or relative contraindication. In absolute contraindication, you already told me. So first one is going to be patient suspected pregnancy. Patient suspected pregnancy. Second one is going to be current PID. Third one is going to be patient having undiagnosed bleeding per vaginal. And third one is going to be patient is having history of ectopic pregnancy. Patient having history of ectopic pregnancy. Is that clear? Most common site of ectopic pregnancy is going to be ampulla. Non-tubal site, most common is going to be ovaries. Okay, and remember the criteria yesterday. Ovarian for, what is the name of the criteria for the ovarian ectopic? Spiegelberg criteria. For abdomen, Study Ford criteria. For cervical, Rubin's criteria. For cervical, Rubin's criteria. These is the PYQs. Okay, they are the all PYQs. Need PG. ठीक है ना? Ovarian का पूछा था. So remember, study for abdomen. How do you remember study Ford? D in abdomen, D in study Ford. ठीक है ना? चलो. Relative contraindication. First of all, patient having anemia or patient having fibroid. Is that clear? Yes. How do you differentiate fibroid with adenomyosis? Uniform enlargement. Adenomyosis. Non-uniform fibroid. ठीक है ना? Followed by that patient giving a history of PID. Then any malformation of the uterus. Patient having any septate uterus or bicornate uterus. Most common Malaysian defect is going to be septate uterus. Septate, and the management is going to be hysteroscopic resection. Hysteroscopic resection, or a patient with history of multiple partners. Sir, why patient with history of multiple partners has a contraindication? Now, multiple sex partners more prone to the infections, and patient having infections, you anyway had to take out the IUCD. So this is going to be a relative contraindication. Now, sir, IUCD patient is having polymenorrhea and menorrhagia. Management is going to be, क्या करोगे? Very good. Reassurance plus folic acid. ठीक है ना? Iron folic acid. ठीक है? Now, if patient is having pain, that means patient is having infection. What will be your management? So we are going to remove plus antibiotics. Okay. Simple two things you will remember like this. Okay. Two things you will remember like this. Inside uterus, you will go with hysteroscopy. They will give a big story, big case, and mention that on examination it was found to be that this is inside the uterus. Your answer is going to be hysteroscopy. If they mention outside the uterus, that's going to be laparoscopy. That's going to be laparoscopy. And I've yesterday mentioned that laparoscopy is contraindicated in shock. Whenever shock is given, laparoscopy is contraindicated. Why? Because it will decrease the cardiac output. Patient will have more hypotension. Is that clear? So that is contraindicated. So that's all till now. Chalo, let's have a quick recap and take the break. थक गए? हाँ? Chalo. Answer, guys, faster. So after that, we'll have a break. Chalo, let's have all the recall whatever we studied. Okay, close down your notes. है ना, फायदा ही नहीं है अब नोट्स खोलने का. अब एग्जाम में भी फिर ओपन बुक सिस्टम कर दो, एग्जाम लेके जाओ एनवी. हाँ, वो ऐसे क्वेश्चन पूछेंगे वो नोट्स में भी नहीं निकलेंगे, ट्रस्ट में. है ना, टीचर खुद भी जाएगा ना देने, वो भी 180 लाएगा. या ही कैन नॉट स्कोर मोर देन दैट. he can only score in his subject, right? All 90 nobody knows. है ना, चिट्टी हर कोई थोड़ी है. यू नो चिट्टी, रोबोट. चलो, let's start with the first one. We started with the chapter pneumoconiosis. Okay, so first of all, I discuss about the most common pneumoconiosis is going to be silicosis. So what are these pneumoconiosis? It means the patient is having a respiratory condition due to the exposure to the dust. Now, what is the dust seen in the silicosis? Silica dust. What is the dust? Silica dust. Second one is going to be, it's the most common type of silicosis. And the patient of silicosis are more prone to the tuberculosis. And what is the calcification seen? ओ मुझे टीवी नहीं है, मुझे दिखा रहा है. पता पता नहीं तूने इगरा कब किया मेरा. चलो. Now patient is having a classical calcification called as eggshell calcification. Okay, and popcorn calcification on the chest X-ray is seen in hematoma, and most common benign tumor is going to be pulmonary hematoma. That's going to be pulmonary hematoma. Okay, and what is the appearance on the chest X-ray? Snowstorm appearance. Snowstorm appearance, and it's due to the exposure to the silica dust or the stone dust. The second one, only pneumoconiosis that is associated with the malignancy is going to be asbestosis. The most specific malignancy is going to be meso. Most common one is going to be adenocarcinoma of lung. What is the marker for mesothelioma? Calretenin. What are the bodies? Samoma made up of calcium. What is the stain for calcium? Von Cosa stain. Then the third one, what are the bodies in asbestosis? Ferruginous bodies, guitar-shaped bodies. Third one, we discuss about the anthracosis. What is the dust? Coal dust. Anthracosis plus rheumatoid arthritis is going to be which syndrome? Kaplan syndrome, also called as rheumatopneumoconiosis. Then if a patient is having exposure to the cotton dust, your answer is going to be Bessenosis. Monday chest tightness, sugarcane dust, iron dust, sidrosis, airspace industries, berylliosis, bird droppings. Now last one. Tell me which of the following condition, okay? Which of the following condition is associated, in which of the following industry patient will have what? Which type of pneumoconiosis? Glass industry, shipyard industry, What is the prevention for bagasosis? 2%? Grain husk, farmer's lung, or moldy hay. Is that clear? What are the vaccines given at birth? Very good. Now, what are the vaccines? Need no diluent. Yes. OPV, need no diluent. OPV, है ना? Now, what are the vaccines? Sterile water as a diluent. MR, what are the vaccine? Phosphate saline buffer is a diluent. JE. Is that clear? Now, side effect. Intersusception is a side effect for. Persistent crying is a side effect of. Thrombocytopenia is a side effect of. Neurological complication is a side effect of. And one more thing, GBS is a side effect of killed influenza. Influenza, what is the vaccine strain? What is the vaccine strain? A72009 Caliph. Gerelin for mumps. Edmonds Zagreb for Danish 13314 for RA2734. Salk for IPV. Sabin for Oka for chicken pox. And Japanese encephalitis live killed. Is that clear? Now, which are the vaccines you can give up to 1 year? BCG, Rota, pentavalent, first dose. Japanese encephalitis up to 15 years. Pentavalent, second and third dose up to. Is that clear? Yes, is that clear? Now, followed by that, we discuss about the. उसके बाद discuss क्या किया हमने? Food adulteration diseases. Now, I will tell the food adulteration disease. You tell me the toxin. Latherism, aflatoxicosis, endemic ascites, pyrrolizidine, epidemic dropsy, sanguine, ergot alkaloid, ergotism. अब मैं feature बताऊंगा. You tell me the diagnosis. Patient coming with osteoparalysis. Patient coming with vasospasm, gangrene. Patient coming with jaundice and ascites. Patient coming with cardiac failure and edema. Patient coming with hepatocellular carcinoma. That's it. Anything else on this? Give vitamin C, ban the crop, aware the people, parboiling of the rice. That's it. Is that clear? Yes. After that, we discussed about contra. नहीं, उससे पहले तो कुछ और kits. Now, I will tell the symptom, you tell me the kit fast. Okay, vaginal discharge, herpetic genital ulcers, inflamed lymph nodes, black, PID, anorectal discharge, cefixime and azithromycin, cervicides, Genital ulcers resistant to the penicillin. Which one? Blue. Is that clear? Yes, it's a management based upon symptoms, not on the diagnosis. Is that clear? Yes. After that, we discuss about OCPs. Okay, what is the name of the regime? USP and Lancy regime. Okay, OCP decrease the cancers. What are the cancers? Endometrial, ovarian, uterine. They increase the cancer. Breast cancer, hepatic cancer, and cervical cancer. Cervical cancer, 16 and 18. Breast cancer, most common gene P53. Now, which drug increases the chances of endometrial cancer? Tamoxifen, by causing endometrial hyperplasia. So what is the drug he will give? Raloxifene. Is that clear? Yes. Now endometrial cancer patient presentation will be post-coital bleeding with obese, hypertension and diabetic. But if a post-coital bleeding with a pyometra is coming, usually it is cervical cancer. Then we discuss about cervical cancer already. Is that clear? Followed by that, we discuss about IUCDs. Now IUCDs, we have a more side effect, menorrhagia. Patient coming with a heavy bleeding, having IUCD, what is the reassure? If IUCD is found in his uterus, hysteroscopy. Outside the uterus, first management is remove the IUCD. Is that clear? After that, we have 4 generations. First one goes to be Lippes loop and the Grafenberg ring. Second one is going to be copper containing. Third one is going to be LNG Mirena. Fourth one is going to be FlexiGuard. Is that clear? Now, absolute contraindication, undiagnosed bleeding PV, your suspected pregnancy, active PID, and the ectopic pregnancy history. Relative fibroid, anemia, malformation of the uterus, and patient having multiple sex partners. Is that clear? Is that clear? Yes. This is vaccines we discuss, food adulteration diseases, kits, OCPs, and IUCDs. Okay. After the break, we discuss about what? Physical quality, PQLI and HDI. Everything is clear so far? Yes. So come after the break, 40 minutes, 45 minutes, then we start.